Hi, I'm Dr. Nicole Comer, one of the family practice doctors at Powell Valley Healthcare, and for Patient Safety Week, I am talking about suicide awareness and suicide prevention. We've recently seen in our community just how much we can be affected by suicide, but what I think we don't realize is that depression itself is really prevalent. 1 in 5 Americans will suffer from depression at some point in their life, and our job is to prevent that from turning into anything more serious than depression and to be able to treat depression. So first we'll start with you as a loved one, what you can do to help prevent suicide in those around you. And I think the major thing that you can do is check on your loved ones. And I don't just mean check on them by text, I mean check on them in person, talk with them, be a safe space that your loved ones can talk with you whenever they're experiencing grief or depression or anxiety or any other mental health condition, and listen and take it seriously. The other thing that I think that we can do is, if you notice that a loved one is suffering, offer to go with them to talk to a provider and to get help, because there are resources available. Next, for those of us that are one of the 1 in 5 that will suffer from depression at some point in our lives, I want you to know that you are not alone. It's very, very common, and just like any other medical condition, there are treatments. You would not skip treating your heart disease or your diabetes, so don't skip treating your mental health. One of the many things that we have available here in the clinic, we have a list of local counselors in all of the communities, Powell and Cody and Grable. And so if you ever wanted just to have somebody to talk to, we have lists available for who is available in the community. We also have a bunch of family practice doctors and advanced practice providers who are all very well capable of helping with depression. So call any of your doctors. There's also medications that can help with depression, medications that can help with anxiety, medications that can help with nightmares and grief. And then for those who may experience suicidal thoughts at some point in their life, we have a wonderful resource available all throughout the country, and that is the 988 Suicide Crisis Lifeline. This is like 911, but for your brain. And so this is a free, confidential service where you call, you're connected directly to somebody who can help manage the thoughts that you're experiencing and help point you in the direction of local resources. We also have a mental health nurse practitioner here in the clinic. Her name is Terry McAdam, and she can manage any number of mental health illnesses, depression being one of those. And so I would just encourage you, if you are a loved one whose family member is suffering from depression, talk to them, reach out, bring them to the clinic, come with them. And if you yourself are suffering from depression, come and see us. We can help.